Hello and welcome back to Yashoda Hospitals online segment, the Health Talk session. You are probably aware of the childhood vaccinations which are recommended to prevent diseases, but you may not realize that adults need vaccinations to stay healthy just like children do. So let's discuss about vaccinations in adults in our today's episode. I'm Dr. Lakshmi, and joining us today we have with us Dr. Kishan, consultant physician from Yashoda Hospitals, Somajiguda. Welcome, doctor.
Hello, I am Dr. Kishan, working as consultant physician at Yashoda Somajiguda, Hyderabad.
So doctor, we are here today to talk about vaccinations in adult population because this is so important and less often discussed. So what do you have to say about this?
So we know even in low and middle income countries, there is a good coverage of vaccination among children. Even in India, most children are vaccinated against tuberculosis, that's BCG, on day of birth. They get oral polio vaccine, they get DPT, they get hepatitis B vaccine. So the coverage for these vaccines as part of national immunization programs in various countries for children is more than 90%. But when it comes to adults, the amount of vaccines that are used for adults who actually deserve and are likely to benefit from various vaccine preventable diseases is abysmal. So many countries are now moving away from childhood vaccination to childhood and adolescent vaccination programs. But in India, when you look at adult vaccination, there's hardly any data, but the amount of vaccine preventable disease is likely to be very huge. Similarly, there are several other infectious conditions, for example, influenza, which is a common respiratory pathogen, pneumococcal infections, varicella infection. All these infections also, if an adult has a comorbid conditions like diabetes, coexisting lung disease, etc., or chronic kidney disease, they are likely to develop severe illness. And some of these infections can be prevented, or at least severe illness can be prevented by immunizing them. But unfortunately, the awareness is not much about adult vaccination. I think that's why it's very relevant that we discuss this topic today.
Yeah, I think I absolutely agree with you because vaccines have eliminated few diseases in the past, especially over the past few generations, which has caused death and which has severely disabled many people. So undoubtedly, it's very important for the kids. But now coming to adults, do you think it's really important or what's its significance?
As you have rightly mentioned, vaccines have helped us eradicate some diseases like smallpox, and to major extent polio has been eradicated, except for occasional cases we don't see polio at all nowadays. But when it comes to adults, is there a benefit? Is there relevance for adult vaccination? I've already pointed out a few things, that the infectious disease burden in our country is huge because we are densely populated and most infections tend to spread very easily. And even in India, forget Western countries, the non-communicable diseases like diabetes, hypertension, obesity, cardiac diseases, the prevalence is increasing decade after decade. And these patients who are even 40 plus, 50 plus with these comorbid conditions, if they develop an infection like influenza infection, which is what we call common flu, if they have these comorbid conditions, then they are at risk of higher risk of developing severe infections like pneumonia, hospitalization, etc. So definitely there is a role for vaccination among adults because the burden of vaccine preventable disease is huge in our country.
I'm sure the term vaccine or vaccinations have become more popular, especially post-COVID era. But what are the barriers in general for adult vaccinations, doctor?
One of the most important barriers why there is hardly any vaccination coverage for adults who deserve vaccines or likely to benefit with vaccines. One of the most important thing is lack of awareness. It's not just lack of awareness in general public, lack of awareness even among clinicians. That's the most important thing. Second thing, we do not have adequate data about the efficacy of those vaccines. Is it cost effective? Third thing, the affordability, because these vaccines in our country are not covered by the government, the people will have to pay from their pockets. So affordability is an issue, and accessibility, because not all small clinics, in small towns, these vaccines are freely available. And with aging, there is something called immunosenescence. Their immunity starts waning decade after decade. And with rise in non-communicable diseases like diabetes, hypertension, obesity, cardiac diseases, chronic kidney disease, etc., the risk of severe infectious burden, like if at all they develop an infection, the risk of them developing a severe illness is very likely in patients above 50, etc., because there is a huge burden of non-communicable disease in this population, age group.
So with adequate level of hygiene and cleanliness and clean water, do you still think that there's need for vaccine? I'm sure this is one of the most common doubt what everyone has on their minds.
See, adequate water and food hygiene, water sanitation, they'll definitely reduce risk of water and foodborne diseases like cholera, typhoid. But in our country, even in urban areas, suburbs, we are way away from the ideal sanitation standards that are required. And there are several other infections which are not food and waterborne, like influenza infection, pneumococcal infection, which are more of airborne diseases. So they cannot be prevented by improving food and water hygiene.
What are the infections or diseases which can be prevented in the adult population with vaccination?
So when we talk about adult vaccinations, we talk about vaccination in general, which is applicable for all adults, and vaccination for certain specific groups. Let's say, for example, pregnant women. They all receive Tdap vaccine as part of their national program or guidelines. But nowadays we encourage them to take influenza vaccination, rubella, varicella, which are not life-threatening conditions. In fact, rubella is a self-resolving illness outside pregnancy. But if a pregnant woman acquires rubella infection during pregnancy, for the mother it doesn't matter much. But the congenital rubella syndrome, the infection spreads to the fetus and the baby is likely to have significant defects, birth defects. I want to focus on two vaccines here. One is influenza vaccine and second one is pneumococcal vaccination. Adults above 50 age group, who probably did not receive any vaccines, who have some amount of immunosenescence, and who in general the risk of hypertension, diabetes is very high in this age group. So if they develop simple viral infections like influenza or simple bacterial infections like pneumococcus, they are likely to develop severe pneumonia, they are likely to require hospitalization. For them it is likely to be beneficial. Another vaccine that I want to talk about, which is very important for which is important for everybody, but especially for people associated with healthcare profession, hepatitis B. If a person acquires hepatitis B infection, there is a good risk of them developing end-stage liver disease. And we have a vaccine which is very safe, very effective, which is freely available, not too expensive. It's a vaccine which needs to be taken in 3 doses.
So doctor, we've discussed about various infectious conditions or diseases which can be prevented with vaccines among the adult age group. So are there any cancerous conditions which can also be prevented with vaccines?
It is not just that vaccines prevent only infections, because we know that certain infections are associated with cancers also. For example, HPV, human papillomavirus infection. We know that by preventing HPV infection, we can prevent cervical cancer. So another thing, hepatitis B infection. We know that people who have cirrhosis of liver are at risk of developing hepatocellular carcinoma. So by preventing hepatitis B, to some extent you will be able to prevent hepatocellular carcinoma as well.
So we've been discussing about the importance of vaccines among the adult age group and how it is underutilized, especially in our country. Now it's time to take few questions what we've got from our audience out there. So taking the first one, are vaccines safe for all age groups?
Most of the vaccines that we have discussed now have been there for decades now, and they're very safe vaccines. Of course, there are few exceptions, like if they have history of allergy to any of the components of the vaccine, then we need to probably avoid the vaccine. That's why it's important that in general, if somebody wants to go for some particular vaccine, it's important they discuss with their primary care physician.
Taking the next one, do vaccines provide better immunity than natural infections?
We generally tend to think that natural immunity is the best form of immunity. But it's a $1 million question. Nobody can categorically say which one is better. But definitely we know that the memory with a natural infection wanes with time, and then vaccines definitely increase our immune memory. They stimulate our T cells and then improve immune memory and then give long-lasting immunity compared to natural infection.
The next one, can 2 vaccines be given at a time?
Multiple vaccines can be given at same time. For example, you can give pneumococcal vaccine along with influenza vaccination, etc. Generally, we don't combine live attenuated vaccines with other vaccines. Otherwise, other than live attenuated vaccines, usually more than 2-3 vaccines can be combined together.
And taking the last one, do I need to be vaccinated against diseases which I don't see commonly in my country or my region?
So whenever you talk about vaccine, it is preventing an infection that you are likely to acquire and the cost effectiveness, because here you do not have the disease. You want to prevent an infection or a disease so that in case you develop that infection, you want to reduce the morbidity and you want to reduce the risk of death. There is no point we taking a vaccine for yellow fever, which is not seen in India at all. But if you're traveling to an African country, then you must take yellow fever vaccine. In fact, that's a mandatory requirement if you're traveling to African countries.
So doctor, before ending this episode, what message you would like to give to our audience out there?
So adult immunization is not a myth. Vaccination for adults is likely to be very beneficial in a country with high vaccine preventable disease burden like India. So depending on your age group, depending on your other medical conditions, whether you're a diabetic, whether you have kidney issue, whether you have cardiac condition or lung condition, you may be recommended certain vaccines depending on your age group and other comorbid conditions. It is important that you consider that there is something called adult vaccination, and when you go to your primary care physician, discuss with him or her. So adult vaccines definitely are likely to be very beneficial in a country like India with a huge infectious disease burden. Thank you.
So this brings us to the end of this episode. We've been discussing about the importance of vaccinations in the adult population. Do join us for the next week as well. Thank you and stay healthy.